Hi guys, I'm here with Dr. Jill Nesham from Cedar Rapids, Iowa, and Jill is one of the earliest adopters inside of the Dr. Cliff AUD Approved Provider Network. And for those of you who've been following my channel for a while, you know that I started the Dr. Cliff Approved Provider Network to identify hearing care providers who are A, following best practices, and B, acting in your best interest. So Jill, thank you so much for spending some time with me here today.
Thank you for having me.
Excellent. So my first question really for you is, what led you to this point where you even felt inclined to apply for and join the network?
Okay, so basically my entire life, I have always been an overachiever. I've never been happy with just okay, just mediocre, or just good enough.
Like I'm talking to a mirror right now.
And so, ever since I got out of graduate school, and in real life practices, that's all I saw. And it was so frustrating because it didn't line up with the things that I studied when I was at the University of Iowa. They didn't match up. There was a huge mismatch, and I thought there is no way that people should have to pay thousands of dollars for hearing aids when there's no follow-up with verification, care, cleaning, oral rehabilitation, counseling. And so basically I found basically you on YouTube, and I thought, you are promoting these best practices to anybody on YouTube. I can only talk to one person at a time when they come to my clinic and see me, and so I just thought this is a great way, like our values and ideals mesh up. So Here I am.
Yeah, I think it's a good point. Like, anybody can sell a hearing aid. I go back and think about all the people who ask questions on my channel. They're like, Cliff, just tell me what the best hearing aid is. And I'm like, no. I literally have no idea.
No. It has, and I tell people every day, it literally has more to do with the skill of the clinician and their tools and their experience than it has to do with the technology in the hearing aid. I can take somebody who is coming in and takes a hearing aid that they bought elsewhere, that they said from day one, this thing's been terrible. And I found out basically they just didn't have it fit in their ear properly, or they didn't have it programmed properly, or maybe their hearing test wasn't even done properly. And once you get all those things right, which it's more complicated than it sounds, then you have success.
I mean, if I just look at the checklist that I compiled from the AAA, who actually developed all these best practices based on what research shows, it's a laundry list. I mean, there are a ton of things on there, and each one of them, and what I like to say is that if you mess up one thing, it can have a cascade effect on messing up other things as well.
Yes, completely.
And so, adhering to these best practices, they're the best way that we know how to ensure that someone gets the most out of their hearing treatment possible. So tell me the story, and I know that you've been doing this obviously a lot longer than I have, but by a few years at least.
You're just more famous.
Right, I guess. I don't know about that, but if you ask the people in your local market who's more famous, it's definitely you.
Oh,
right?
maybe. I don't know. But actually, I'm hoping that everybody in the United States knows who you are. 2020, that'd be great.
Yeah. Well, I would love that too.
You'd love that too.
Means that consumers are really getting the information they need to make an educated decision on their own treatment. So,
exactly.
That being said, when you started your clinic in Cedar Rapids, Iowa, what kind of led you to that point?
So for most of my career, for over 15 years, I'd always worked for other people in other private practices primarily, although I'd also worked in hospital and VA settings as well. But private practice has always been my passion. When I was not even in graduate school, I fell in love with the power of what you can do to help a person very quickly with hearing loss with a hearing aid. One of my most influential professors at the University of Iowa is Ruth Bentler, and she had so much passion.
Legend.
She had so much passion for what she did, and that passion was contagious. And I still have that passion today. But basically, I just found that the best way that I could be the best audiologist was to basically go off on my own and do this myself.
And I hear that a lot, because I think a lot of providers who want to follow best practices can't necessarily do it because the environment that they work in doesn't allow for it.
Right.
And I found that for me, to make sure that I could do everything the way that I felt was necessary to achieve best practices with my patients required me to go out on my own so I could be in 100% control of that.
Yep, exactly. So, and I'm, like I said, I'm an overachiever. I'm kind of a control freak. I just like like how things are done.
Right.
I see every patient who walks in my door for new fittings, testing, follow-up care. I have that control. So I'm not the biggest, but I always say I'm probably one of the best in the area. But I think that's just because we go above and beyond with service and professionalism and care. But I'm a native. I grew up on a small family farm, Cascade, Iowa. Just come from hardworking people and treating people right and honesty and fairness. And I think that our industry and our field needs a lot of that. And this is just my calling. It's just my calling.
Well, I love it, and I really appreciate that you decided to join the network. It's humbling for me to have you in the network. I feel comfortable having people watching my video content who do want to treat their hearing loss to a higher level. If they are in your area, absolutely, I'd be more than comfortable having you be the one treating them. So thank you so much for taking
I won't let you down.
No, I appreciate that. Thank you so much for taking the time with me today. I'm sure this won't be the last time that we do something like this. And if you guys are in the Cedar Rapids area, make sure that you check out Dr. Jill Nesham's clinic. So take care, and I'll see you soon.